In times of crisis and disaster, there's no group that suffers more from a lack of quality emergency medical care than mothers and children. Typically, field hospitals are designed for adult care. That leaves expectant mothers, infants, and children without access to expert medical personnel or specialty equipment and supplies required to provide them with life-saving treatment. We can make a significant difference in both short and long-term deployments with a revolutionary Forts Medical Field Hospital system. This self-sufficient system is capable of operating in extreme weather conditions. It's designed to accelerate deployment, minimize infection, and improve patient outcomes, all while exceeding the new World Health Organization and International Red Cross guidelines. Forts Medical Field technicians maintain readiness, coordinate transport, conduct deployments, maintain system operations, manage supply inventory, and perform preventative maintenance for the entire system. All shelters are fully compatible with worldwide land, sea, or air transportation equipment. Forts Medical Obstetric, Neonatal, and Pediatric Intensive Care medical stations are outfitted with everything in place to begin care immediately. Comprehensive medical-grade utilities are factory-installed to eliminate delays with field installation. Decontamination equipment, medical procedure kits, telemedicine portals, emergency medical protocol software, and patient eChart software further enhance both the speed and quality of patient care. The Base 7 shelter solution is comprised of a command shelter, technical shelter, surgery shelter, 3 ICU shelters, and a central supply shelter. Combined, these shelters can treat, stabilize, and hold a minimum of 12 patients at one time. All field hospital shelters are mounted on trailers, ready to deploy at any time. While it's stored, the entire system is connected to electrical service so that the integrated utility systems, medical equipment, and supplies can be continuously monitored from anywhere in the world. Although each shelter is designed to function together or independently, there is no limit to the number of shelter combinations. Enclosed connecting corridors allow patients and staff to move freely throughout the field hospital, while quick-to-connect utility lines distribute critical services to each shelter. Ramp systems allow patients to be easily transported into the ICU shelters. As the heart of the field hospital, the technical shelter eliminates the time needed to unload, assemble, and test various utility systems. Automated medical utilities are staged in a single shelter. Reliable power, medical gas, potable water, and sanitary waste systems deliver critical utilities throughout the field hospital immediately after reaching the site. The canteen provides a 7-day supply of high-quality dehydrated foods and drinks to feed both staff and patients. A medical device sterilizer, laundry equipment, medical supply refrigerator, and ice machine all bring critical services to the field hospital. As the brain of the field hospital, the command shelter provides real-time information access to accelerate life-saving incident command decisions. Staff can direct patient flow, credential medical personnel, and maintain patient records while monitoring resource levels, safety, security, and environmental systems for the entire field hospital. Chaplain and family services space provides privacy for counseling both staff and family members. As an immune system of the field hospital, the hybrid Level 2 surgery shelter supports a wide variety of life-saving general surgery possibilities, plus trauma and orthopedic procedures not normally performed in a Level 2 operating room. It features a multi-axis electrical operating table, X-ray unit, and a 3D ultrasound patient scanner with advanced software to assist the field physician with an ease of diagnosis. An autonomous anesthesia station allows a trained physician to operate without an anesthesiologist. The HEPA positive pressure air filtration system and built-in dry fog hydrogen peroxide decontamination unit reduce possible infections. As the backbone of the field hospital, the ICU medical shelters waste no time with everything already on hand for life-saving critical care. A combined trauma ward and emergency room, preloaded with medical treatment stations and supplies, is kept in a mission-ready state, so patient care can begin even before the rest of the field hospital is deployed. Each ICU shelter is equipped with interchangeable maternity, neonatal, pediatric, or adult medical stations, capable of treating at least 4 patients simultaneously. A surgical sink and patient restroom with touchless fixtures and HEPA filtration minimizes the spread of infections. Electronic patient records and emergency medical protocol software enhances staff productivity and patient transfer continuity of care. As the muscle of the field hospital, a central supply shelter brings speed and endurance to emergency and remote medical care. This dual-function shelter, staged with ancillary equipment and supplies, also serves as a staff recovery dorm during active operations. Fort's Medical Field Hospital shelters bring life-changing medical care even to the most vulnerable in a crisis or disaster: women, infants, and children. Thank you for helping us make a significant difference.